Thank you, listeners, for joining us. Today's Elko Live is a very special edition of our program as we get to chat with someone whose business has made an enormous impact on the quality of life here in northeastern Nevada, has done so for decades, and her individual contributions. We want to recognize Ester Quilici today. Ester, welcome to the radio show.
I'm glad to be back. And happy spring. It's a beautiful day. And I enjoy speaking with you, Lori. Thank you for inviting me.
Thank you so much for being on the program. Ester is CEO at Vitality Unlimited. Vitality Unlimited, a nonprofit, and now Vitality Integrated Program Services, the VIPS, the Certified Community Behavioral Health Clinic. So we're going to divide the program up a little bit today, Ester, because it's pretty fascinating when you consider the past, the present, and we'll reflect, of course, envision the future for this local Vitality Integrated Program Services, because you have come a long way in more than 50 years, if you can imagine that.
Yeah, it's been 53 years. I'm very happy to talk about the retrospective and the future.
So fascinating. You were born here in Elko, but you were raised in Wells. Tell us a little bit about that, because you are also a daughter of an immigrant.
Right. It was a community. We were raised by a community, very strong knit group of people, and they wanted their kids to go out and do the best and help the world. And we had, my path was a college path all the time. And I went to the University of Santa Clara, California. It was a Jesuit school. And, now that they're reviewing the Pope's life, the Pope was a Jesuit. And so I thought very hard about what I took away besides an education from Santa Clara. And the Jesuits always said, you have to really follow your heart and do critical thinking, whether it takes you from the church or whatever. And that's what the Pope said, follow your heart and do critical thinking. And then they said, make this world a better place because you're in it. And, that's what I've tried to do.
And that explains a lot about your choices, the path that you chose, again, being from the tiny town of Wells, which probably isn't much bigger now than it was when you grew up there, in that you did go away to school and you had those opportunities, which we hope that people have access to higher education or technical training, and that you decided to return to the community. Ester, you could have really gone anywhere in the world. I'm sure you know that by now.
I've thought that over. And, now at this time, I've been with Vitality 41 years. And at this time, I know why I came back. I came because I had a job to do, and my family drew me back here. I needed to come back and help them. And now, guess what? They've grown old and passed away. And I'm kind of like the last one, because I was so much younger in this whole line of immigrants and hardworking people that made this area, helped to make this area what it is. So I came back because I saw the job. I guess looking back in the retrospective, I had a job to do, and that was to support Vitality and help it to grow and stay in business.
And we're going to talk about that now too. From humble beginnings and roots in Wells to growing up in rural Nevada, going away to school, returning because of the love of family. It is impossible to talk about Vitality Unlimited without including Dorothy North. And she was the founder, the chief executive officer emeritus of Vitality. I believe that it was in 2015 that she died, Esther?
Right, in January of 2015.
Okay, and she had suffered a long illness. So how likely or unlikely is it that you and Dorothy met? How would you talk about that?
Well, I came back, I knew Dorothy before I left, because I worked for my dad for a number of years. And then I had met her at a statewide meeting. And she said, the company's growing. I need help. I need another administrator. And so really that's how that happened.
So she'd been in the business for about 10 years or so before you joined?
No, she was in the business about 7. She came in 77, and I came back in 84.
So Vitality was begun in 1971, and this was a really crucial time. This was a drug and alcohol treatment center. But from the research I've done, people I've talked to, and I don't know that Elko is that different, but Elko was still locking up people who were under the influence. You went to jail. You went to dry out, sleep it off. People suffering addiction were driven out of town. They were often disowned by their family, and often they met with a horrible death. Right, Esther?
Well, let me give you my perspective of what I know about how we were founded and how we grew. We were founded by a private-public partnership, which is evident even today. And what is that private-public partnership? The Fed came to a very small rural frontier Nevada town and spread the word. Is anybody here interested in joining a community partnership to help alcohol and drug problems in the community? And they got people to sign up. And lo and behold, 53 years later, here we are. But again, public-private partnerships have aided the growth and maintenance of this organization, because in the beginning, in 71, the community got together, but they did crazy things. Like Dorothy said, they did crazy things like the bookkeeper would grow marijuana on her desk so they could take it out to the kids to show them what not to do. It was totally illegal. And she said, but they got away with it in those days. There's a lot a lot of fun stories, I guess I could tell you, and not so fun stories, because this is what they also had to do. They would put people on a bus. If they had an alcohol or drug problem and they needed detox, they'd send them to Salt Lake, they'd send them to Boise, wherever they could send them out of town, because they didn't want to deal with them in town. And so what Dorothy provided when she first got here is, first of all, strong foundation in recovery from substance use disorders, we call it now, and a vision. And she also worked well with the state, because, again, there was a public-private partnership. Had it not been for the state of Nevada to create a state agency that funneled some of the federal money, you couldn't get these programs to have gotten off the ground, because there was no local support monetarily anyway. There was public support, but not monetary support.
Vitality Unlimited, and now Vitality Integrated Program Services, remains a nonprofit. So what Esther was just describing is this community effort. Concerned individuals who came together needed that federal funding source, which is what we still require today. Federal funds, state funds, they provide matching money. They often pay for infrastructure. We can't afford it alone, especially in rural communities, but we still have these problems. You can't make money on everything.
You hope to break even. You can't lose money either, and the wraparounds that we develop for the CCBHC are costly. They are beneficial. They provide the best foundation because they address the whole person, but they are costly. And they seem to be more costly out in a rural frontier area. Why? Because it's an inducement to get people to move out here. And we've also been able to utilize the artificial intelligence with real success. And, we can Zoom to people who need our services, and we get education that otherwise would not be available to us, to the staff.
A lot of this has happened fairly quickly. It's ramped up pretty fast. You were talking about having to go to the state, and I wanted again to recall, at least in my experience, I was fortunate enough to meet and to know Dorothy North. And my impression of her is that she defined fearless. She would walk into a room. She would walk right up to everyone. She was straightforward. She left an impression. And she and those supporters you described are responsible for many of the legislative changes that Nevada underwent in the early days, leading up to reform in diagnosis, care, and treatment.
Well, I think you hit it right on the head. In the day that Dorothy was still active, she did a lot of lobbying. We do have a representative now for Vitality Unlimited that we employ during the legislative session to make us aware of the things we need to be aware of. And if we have issues we want addressed, we pass them to Sarah Adler, and she represents us at the legislature. And for instance, we were able to affect a big change that was important in this field, that I believed there was an inequality in the number of hours that alcohol and drug counselors had to serve as an internship vis-a-vis these other licenses like LCSWs, CPCs, MFTs. So we presented a bill through Sarah and got it passed. And so now it's a parity issue with other fields. And it's important because we're trying to cut the barriers, Lori, to our field and the barriers to helping people. And it seems like we just get more barriers to overcome, but we do it.
Well, that's what I was just going to ask. So for this entire 50 years, I mean, who knows what Dorothy would think of what's happening now, but Vitality has evolved. You've risen to meet the changing needs of patients, clients, their families, but at the same time, you have had to ride the stigma, right, of serving patients with addiction, helping families understand how they can help and that they're not to blame. I mean, there's still a lot of stigma surrounding addiction, or I'm sorry, you used a different term.
Right, yeah, but the evolution of the terminology that's used to address alcohol and drug problems or chemical dependency or substance abuse is now, it's now a diagnosis, and it's substance use disorder, mental health disorder.
Okay.
And it's important because now the terminology is on a parity also. Absolutely.
So I'm going to make careful notes about that. But Vitality has been writing this stigma at the same time because, and we can see it even in the current changing time, that there are still people who think that this is some sort of a choice.
Yeah. I mean, go figure. It is a brain disease. It has signs and symptoms. It was incorporated into the medical criteria for the Medical Association back in the 50s. And, well, is there a certain amount that you have to put into it yourself? You bet you do, but it is a brain disease, and you have certain signs and symptoms, and you have ways that you have to stick to recover. And recovery is a process. It is not just being sober, but it's a life change, a positive life change. People are in recovery from mental illness. People are in recovery from substance use disorder. And guess what? People do recover. And one thing I'd like to say is that women in the medical field and in the clinical field have been very instrumental in moving mental health disorder treatment along, and also substance use disorder.
And again, that is a big role that the VIPs play in our community. I wanted to, because we are in the present now in our discussion, talk about the impacts of those wraparound services you described. The Certified Community Behavioral Health Clinic was really piloted or pioneered here.
I think, well, yeah, I was, look, we were a demonstration project in 2016. There were 3 demonstration projects in Nevada that survived. 8 states were given the opportunity in 2015 to develop these programs, and we started in 2016. So we have a rural frontier program here in Elko. We have one operating in Carson that's a rural. We have one in Dayton. And we developed an urban CCBHC in Reno. So this morning I was on a conversation with someone in Texas, and they said, "You mean you're an OG?" And I said, "Yeah, because of being a demonstration grant, we're considered an OG in the system. Because when we started, there were less than 60 CCBHCs. We showed that the concept worked and how it could work in different locales. Now there are over 500 CCBHCs in the country. And so with the wraparounds, what it did is address the whole person, because not only do we do mental health and substance use disorder, but we address the physical aspect of a person. And that's what it means to wrap around. And we can provide peer services, we can provide targeted case management, and those services are really called out through the Medicaid program. Unfortunately, private insurances don't pay for peer services. What is a peer? It's someone who has a lived experience. And in AANA, they call them sponsors, but these are people that can give you advice from their lived experience, how they've been successful, how they stay sober, how they address their mental health problems. And these targeted case managers just help a person define what it is that will help them be successful, what services they need, and help them access these services. So those are the wraparounds that address the whole person. And I think individually, you get at it's almost like the home. Medical home, if you've heard about medical homes in the medical vernacular, because it has one person that provides the direction of the individual and then calls for the wraparounds. So you have, it doesn't have to be uniform, it just has to be individualized.
Individualized, whether you're a teenager or a veteran, a senior citizen, a working professional, right, Esther? Because we know that these are the lives that are being impacted.
That's right, and it's confidential. And the youngest we've had here in Elko has been 3. The oldest we've had in Carson City has been 92. So it's broad spectrum, cradle to the grave, and family oriented, and that's the important part. Individual treatment, trauma driven, because they realize trauma not only for physical trauma, but emotional trauma, psychological trauma. It is trauma driven, so that we pay attention to the triggers that may cause relapse or at least hinders recovery.
This is a lifelong process, so you're providing tools for people to launch.
That's
right. So being a nonprofit, how are you faring in the world today? We just keep hearing day in and day out now about cuts, programs going away, and it doesn't look like there's an end in sight. If you're a nonprofit and you don't align with the ideology of the current administration, then it's possible that you could face cuts.
So I think Medicaid has been a primary driver for CCBHCs. Medicaid, since Governor Sandoval was the first state in the United States to expand the population other than women with children. So you know that they saw the need and they addressed it. And he and his chief of staff were visionaries. So that's why I think this program has worked so well for us in Nevada. And I think that for the future, people have to make sure that the Medicaid doesn't change, that opportunity is available when needed, that the wraparounds that we can provide are because we get a higher rate, and that otherwise it would be impossible to do all that's done. And so for the future, we're on pins and needles too. We don't know what's going to happen to the future. Are they going to leave us alone? I do know one thing, and I want to put that out, and that is that Elon Musk is a big employer in the Reno area, and I was told that he just keeps most of his employees at a level that they still qualify for Medicaid. So maybe that way they'll keep Medicaid safe, because if his employees can qualify for Medicaid, maybe they don't want to rip it out from underneath them and have to pay for the services.
Well, and that is a reality, certainly. When you can have a government subsidy, it can count. And it's important to note, too, that as a nonprofit, Vitality Unlimited, the VIPs in our community, you do accept most insurance, Medicare, Medicaid, sliding fee, right?
That's right.
I'm not. Is it fair to say that people are not turned away for ability to pay, or how do you structure that?
I think so. I think you could say that. And we aren't grant funded. See, somebody said just the other day, well, won't your grants pay for this? We're fee for service. We make the money we need to stay in business and pay our bills. We are not grant funded, and fortunately, we're not grant funded, because it makes you wonder if that's in danger too. But you could say that no one would be turned away in any circumstance unless they don't want to comply. I mean, we have to have some information on their financial situation. If they say I can't pay for the services, well, they just have to fill out some paperwork. However, and one of the things I want to say is still a vestige of the state organization is we have an office in the box that comes to us from from welfare. They call it the welfare department, and who will come in and register people for Medicaid, for state services, for if you need food stamps, if you need other assistance. They come right into our treatment center. They come right into the clinic. So if you don't want our services, but you need their services, just call us. Find out when they're coming, and you can come and talk to them privately.
So that's a really important service, because also I'm sure in your experience, you haven't run into a lot of people who want to stay exactly where they are, right? I mean, they're looking for an out.
Yeah. Certainly are. I mean, and I think it's hard to take the first step for some people, and they don't realize really how much there is to come in and comfort them and support them and say, look, you're making the right decision.
So how about the local landscape when it comes to, mental health care, behavioral health? That's kind of the big buzz phrase right now. We have licensed clinical social workers, of which you have the benefit. Vicki LaVersa has come on the program many times with Marianne McCowan, and certainly her specialties are appreciated. Psychiatrist, we have life coaches now in the field, right? I mean, I guess there's more in Elko than there used to be, but
much more abundant in Elko. I'm surprised. All of a sudden, it just seems like there are more opportunities, and I don't know why. I don't know. Maybe people are coming back to the community. I don't know what would make that suddenly be more evident. But guess what? We're still on the bottom rung of the 50 states.
Right.
So I think that I think they're going a lot of the times, mainly to large cities like Reno and Las Vegas, but we do get them out here too.
And it's important to note, we're talking with Ester Quilici, and Ester is the CEO at Vitality Unlimited. Vitality Unlimited is a nonprofit and is now includes the Vitality Integrated Program Services, a certified community behavioral health clinic. So with the variety of services that people have available to them, you could probably sit back and say, wow, I've been there, done that. We've seen a lot. What's to come, right? When it comes to either Vitality or the Elko community, obviously we need to do more.
Well, what's to come? I mean, when opportunity knocks is what's going to come. We're looking at a van program that's sponsored through the opioid money through the state of Nevada that might reach all the outlying communities outside of Elko. And so we were just talking about that negotiation this morning. That's one of the things that might come. We may expand again. We may go to Las Vegas, and we have a partnership down there that may turn into another clinic. And we're just going to wait as opportunity knocks. And it's not that we're not looking for opportunity too. It's not we're passive. We just are going to see what happens. And then, we're waiting, like I said, on hoping that there are no major changes so that we can continue to provide the work we're doing. And in Reno, we're expanding into IOP programs for adolescents. We're working with children. We are working with some of the MCOs that have money that's available for grants to provide services to kids. And those are the things that we're looking at right now. The Medicaid world is going to be changing in the state of Nevada in 2026. It's going to go to MCO, managed care organizations, which are difficult to deal with, lots of red tape. And unlike the state that was in business with Medicaid to help us provide services, these MCOs, number one, are here to provide themselves with an income. And, and I believe they're next, that's my humble opinion, then they next want to provide services. So we're navigating that right now. We've been working with MCOs for years, but now they're going to be into the residential part of alcohol and drug treatment. And it's PT93 is this new category, and it is, I think we're going to have two MCOs out here in the rurals, and then I think there's 6 of them altogether. And so we are trying to make a good connection with them, have a good rapport, and do the job we need to get people treated from the Elko area, from any of the other areas we operate.
Wow, that is big news, Esther. And does that erase things like access to healthcare? I mean, right? Because access to healthcare helps people navigate their Medicaid, Medicare, correct? And so,
what do you mean access to healthcare?
Well, the agency I just went to the Medicare meeting sponsored by Elko's work group, Elko's Medicare work group, at the library last night, and discovered how complicated that system is. So we do have a local agency, a nonprofit. Yeah.
Oh, okay. Well, that's good. That's news to me. Thank you.
Oh, good. That's good.
I'll give you
all
news.
the
You give me
details.
news. I appreciate that.
Oh,
yeah.
Of course. So I mean, they're not caseworkers or anything, but they're the doorway for a lot of people that don't know how to access, their Medicaid, Medicare, especially. But
because we take Medicare also. And
absolutely.
That's a different realm and different portal. They have now these portals. If you're going to do the bills, you have to do their portal, which is an electronic means by which you get your information into their system so that they can give you a prior approval, continued stay approval, and they can also push back on you for whatever. So I think that if there is an organization that will help people with Medicaid and Medicare, and don't forget the office in the box is, I think, a good source also.
I think it's just from what you said, though, maybe it could be misleading. If a managed care organization comes in, how does a person know that they're dealing with a managed care organization or a free agency, a nonprofit, someone that's just trying to help them access the benefits that they're already entitled to?
Well, if they have Medicare, or Medicaid, if they have Medicaid, they're going to have to deal with one or the other of the MCOs.
Wow.
So then the MCOs, believe me, have quote-unquote reps that are supposed to help you. So they would go to the rep that represents that MCO, Silver State or Care Source. Care Source is out of the Midwest. Silver State is a Centene organization. Centene is one of the largest healthcare organizations in the United States. This is what is happening. We're dealing with break-offs of these big mega healthcare corporations that reinvent themselves in different names. And they seem to, they're all gearing up for this 2026 rollout for the rurals. And it gives one pause as to just how it's going to work. However, we have been dealing with these MCOs for quite some time with outpatient Now we're going to be dealing with them in inpatient residential settings.
So it sounds like you'll have to come back and talk to us more about navigating this.
Oh, what fun. Thank you so much.
Well, yeah, that's something new and different. So I guess as we're nearing the end of this, you were recently recognized for decades of contribution to healthcare, Esther, and I know it's not something that you're jumping up and down about, but you did receive a significant award. Would you mind telling us about
Well,
that?
I think that what we did is we got recognition from National Council. Who is National Council on Wellbeing? It is the largest nonprofit association in the United States, and it deals with mental health and substance use and related organizations. And so the recognition that we got is that I was asked to present at the national conference that's coming up in Philadelphia. And it was funny because I kept saying, well, I'll see you in Pittsburgh. And finally, Dottie said to me, well, I'm going to Philadelphia. You're going to Pittsburgh. I said, gosh, I'm glad you told me about that. Yeah, and one of the places that I will be participating is it's actually just a panel, and it's Innovations Integrating Substance Use Care and Partnerships in the CCBHC Model. You know, what I find interesting is that we were substance abuse disorder treatment providers. This is what we did, and we saw the value of the whole person in integrating mental health. Apparently, in most parts of the country, they were mental health people, and now they're trying to figure out how to incorporate substance use disorder treatment. And I said, hello, welcome to the party. I mean, we've been at this, look at this, 53 years. And our focus has been substance use disorder with, now we integrated in since 2015, mental health services. But now these people out there, these companies are trying to figure out how to integrate substance use disorder into their mental health. And it was an impetus by the federal government because they saw that this was still lacking. And I thought, wow.
It's taken this long. Co-occurring or concurrent?
Co-occurring.
Yeah, right.
You would think co-occurring to everyone would have meant co-occurring. No. Then this is how they're trying to push this through and get a way that, to get this more widespread.
Well, Esther, again, opening the door to future conversations. You mentioned Dottie. Dottie Dexter is your trusted CFO and advisor, and you are both, it is apparent, you are both active in running this business, which is now statewide in Northern Nevada, as you alluded to, could be headed to Southern Nevada as well. Recognized for decades of contribution to this type of healthcare. And I guess in closing, until we meet again, what you want people to know about this business, which is your life's work, because it truly can't be easy. You must have been tempted to walk away before, but maybe your Jesuit training, your background, your education wouldn't let your heart go that direction.
Yeah, it's had some dips. It had some real heavy lifts, and we've had some troubled financial times because of the change in the healthcare financing and the lack of finding people to come into a rural community in Nevada. And that has lifted a little bit. And, we've had some strong support from the city, some real advocacy there, strong support statewide. And I think that's been a great boon to this company and the people with whom that work for us. And so for this future, I think that we want to lift the stigma and have people feel not so self-conscious about getting help or not feeling that it's such a moral issue or spiritual bereavement to seek services. I think we have made headway. I know we've made headway because we have a large census. And I think that all over the state. So that's a good thing. And our profile I think, has risen as a company, and I think it's important that people know that, because I think that we're more visible. The help is more visible. That's what I mean, is our profile has risen. They know that there's help in the community. Not only us, but there are others. But we do provide a full service delivery system, cradle to the grave, wraparounds included.
Thank you, Esther. We really appreciate your time. Ester Quilici, the CEO, Vitality Unlimited, Vitality Integrated Program Services, Community Behavioral Health Clinic, a nonprofit. And until we meet again, it was great to catch up with you. It was wonderful to reminisce about Dorothy.
It was. Thank you. Yeah, happy trails to you too until we meet again.
Thank you, Esther. And thank you, listeners, for joining us for Elko Live today.